So today we will talk of cancer of the stomach. Hello everybody, my name is Dr. Zubin Dev Sharma. I am a senior consultant in gastroenterology, hepatology and GI endoscopy. So today I am with you all to create awareness on an entity which is quite problematic. It creates a lot of morbidity and mortality in patients. And world over, there is a lot of differences that actually happens in the prevalence and the incidence of this particular disease. So today we will talk of cancer of the stomach. So let's talk about how we can identify it, how we can find it early, detect it early, how can we treat it early if we find it, and how can we do more aggressive treatment and increase the survival of our patients of CA stomach or cancer of the stomach. So let's talk of cancer stomach. So see, stomach is the organ which is in between your food pipe, that is esophagus, and the small intestine. The stomach, the main function of the stomach is to accumulate the food that you eat, mix it with the acid that is produced in the stomach, churn it up, break it down into smaller pieces, and then push it down into the small intestine, that is the duodenum, for digestion as well as absorption. And there is a lot of disorders and diseases which can affect your stomach. Cancer of the stomach is one of the most serious illnesses that can affect it. It is still very, very common in the east part of the world, that is Japan, Korea, Thailand, Asia. It used to be less common in the western part. But with the growing complexity of intercontinental travel, common food, common practices, the incidence is increasing across the world. In Japan, they have a screening program for detection of early gastric cancer. But this screening programs is not very common in rest part of the Asia, India, Southeast Asia, in Europe or in USA or the Northern Americas. There have been reports of less incidence there, but now I think it needs to be identified across the world. So what are the factors that first lead to development of cancer in the stomach? So there are various reasons behind somebody would develop a cancer of the stomach. One of the most common causes is infection because of H. pylori, that is Helicobacter pylori. Now H. pylori is a bacterium which stays in the lining of the stomach, and it creates a cycle of chronic inflammation. That means repeated inflammation happening in the stomach, which leads to permanent changes in the mucosa of the stomach and thereby giving rise to future possibility of cancer. It usually goes from simple inflammation to chronic inflammation to something we called as an intestinal metaplasia. That simply means that the lining of the stomach is changing its character to more intestinal type. From metaplasia means multiplication of the cells, it changes to something called as a dysplasia. Dysplasia means that they will even now start not only the number, but they will start behaving their character also. And this dysplasia or the changed character of those cells finally leads to development of cancer. So H. pylori is the number one reason for somebody to develop a carcinoma stomach. There are other identified reasons also. Other things like if you have atrophic gastritis, atrophic means, again, this is an endoscopic and a biopsy finding. What it means is that the lining is getting thinned out, the cells are less in number now, and whatever new cells are coming, they would be erratic, they will be dysplastic. The third possibility is something called as an autoimmune gastritis. Again, autoimmune gastritis is something that your own body is trying to destroy the cells of the stomach, and those new cells that are coming up at this age are usually abnormal. There are lot of other reasons also. Some of them are genetic reasons which are not really identifiable in every individual. That is why there are geographical differences that people from Japan, from Korea, from Northeast India, some from the northern part of the Southeast Asia, as well as some areas of pockets in Europe tend to have higher incidence of CA stomach. Now, what are the symptoms that somebody may develop if they suspect CA stomach? So the problem with carcinoma stomach is that the symptoms are usually not very pronounced, and hence why we need a screening program for it. But in people who do develop it, the symptoms are usually of upper abdominal discomfort. That means you may find bloating, you may find vomiting, you may find some amount of postprandial fullness, that you eat food but you eat a small amount but your stomach is full. And usually these patients will have anemia. That means their hemoglobin would be on the lower side. Some of them may also complain of black colored stools. That means they're actually bleeding into their intestines. And some of them may actually have other features also. Now, as the symptoms are not very specific, a lot of the times we detect this cancer at a very, very late stage. And that is a fact that has haunted Southeast Asia, Europe, and US for the same disease. To some extent, Japan and Korea and other Asian countries have done a good job of trying to identify it early. Now, once you know the symptoms, how can we first identify it, and what else we can do to identify it early? So the simplest test to do this would be an upper GI endoscopy, an endoscopy done from your mouth, which basically passes the camera down into the intestines, into your stomach to see what is happening inside. Once they go in, they need to examine your stomach thoroughly, if available, and preferably with something called the narrowband imaging as well as magnification endoscopy. That is what is used across the world in Europe as well as in Japan for screening. Once they have identified an area which possibly may be a cancer, they may take biopsies from it. If it is a large, obvious mass in the stomach, it will be visible with a normal white light endoscopy also. So the whole onus is to find it early, because if you find it early, there are methods to treat it in a curative way. That means that you will completely cure the disease. But the problem is, as I already told, you usually detect it when it is quite late. So once you detect it early enough, there are methods like endoscopic resections only, through endoscopic some mucosal dissection or endoscopic mucosal resections, where you can completely get rid of early tumors. But if you are finding it late, then the treatment option becomes limited. It will involve a surgery to remove the stomach, to remove the lymph nodes around the stomach. If it is also involving other organs like the omentum, the peritoneum, the liver, some lymph nodes outside of the vicinity of stomach, in that case, chemotherapy might be the first option that might be required. So carcinoma stomach is a problematic disease. There are some risk factors which are aware of. There are some preventive methods that we can do. Some kind of food stuff like smoky foods are also associated with it. We may be able to find it early if we are in a screening protocol. So whom should get screened? If you are with a background being from East Asia, if you are elderly and your symptoms have suddenly come at an elderly age, if there is a family history of carcinoma stomach or a colonic cancer in your family, if you have symptoms which are not getting relieved by routine medications, in those cases, I will certainly recommend to do an endoscopy to try to find the disease early rather than late. So if you have any more questions on carcinoma stomach, please ask us in the comment section. You can also give it on a WhatsApp number. We will try to answer it to the best of our knowledge. Thank you so much, and I hope you find this useful. How to connect to us? I think it's not very difficult. The number is given. On this number, you can message us, WhatsApp us. A message will come back to you on how to take appointments. Appointments can be a physical appointment or an online appointment. A physical appointment is available at Fortis Memorial Hospital in Gurgaon in Haryana. And for online, there is an app which will be given in the message itself. You can also try to connect to this number. You can call this number. The coordinator will pick it up and guide you if you have any problems in trying to take appointments. So please feel free to message us. And the appointment is not difficult. As soon as you WhatsApp us, you will get a message for it. It may be some delay because there will be a lot of work going on, but you will definitely get a message. So thank you so much.